Chronic kidney disease. Richard Bright, M.D., the father of nephrology, born in 1789, died in 1913. In 1827, Richard Bright published a book, Reports of Medical Cases. He recognized the features and consequences of kidney disease. For the next 100 years or so, it was known as Bright's disease, referring to any type of kidney disease. His findings led to the widespread practice of testing urine for proteins, one of the first diagnostic tests in medicine.
Body systems affected. Chronic kidney disease is a condition in which kidneys are damaged and cannot filter blood as well. Kidneys help control blood pressure, stimulate the production of red blood cells, keep bones healthy, and regulate blood chemicals. Chronic kidney disease can lead to other health problems including renal failure, cardiovascular disease, stroke, and hypertension.
Frederick Akbar Mohammed, M.D., born in 1849 and died in 1884. The forgotten British Asian physician who changed modern medicine. Frederick Akbar Mohammed, while still in med school, improved the sphygmograph, a device for measuring blood pressure. He discovered the link between kidney disease and hypertension. William Howship Dickinson, born in 1832 and died in 1913. In the 1870s, Dr. Mohammed's discovery of the link between kidney disease and hypertension, furthered by William Howship's research and description of acute nephritis in 1875, moved kidney disease to the next level. Dr. Dickinson was a general physician and was best known for being a kidney specialist.
Chronic kidney disease is characterized by progressive scarring that affects all structures of the kidney and can be caused by many different reasons, such as hypertensive nephropathy caused by high blood pressure, polycystic kidney disease caused by a genetic disorder, diabetic nephropathy caused by diabetes, and IgA nephropathy caused by autoimmune kidney disorder.
Ada and Harry DeBold. She is the mother of the National Nephrosis Foundation. Ada was born in 1917 and died in 2003. Harry's birth is unknown and died in 1956. November the 15th, 1950, the first committee for the nephrosis research met because Ada and Harry DeBold tried to save their child. They were determined to take positive action, and due to her fortitude, the National Nephrosis Foundation was born. In 1964, the lay group NNFF became the National Kidney Foundation. In the 1960s, everything changed with the invention of the Teflon shunt. Transplantation of kidneys from siblings donors was proving to be very successful. Kidney failure was no longer considered a fatal illness, but a chronic disease. Homer W. Smith, M.D., born in 1895, died in 1962. In the 20th century, Dr. Homer Smith revealed the underlying physiology of the kidney. His findings led to important medical therapies for multiple kidney diseases. Smith's discoveries led to a better understanding of acute and chronic disease of the kidneys.
Available tests. Chronic kidney disease can be diagnosed via blood tests, urine tests, imaging tests, and kidney sample tests.
The most effective treatment for CKD is halting the progression. Controlling your blood sugar and blood pressure are very important. Your doctor may place you on medications to control your blood sugar and blood pressure so as not to cause any further damage to the blood vessels and kidney structures. However, if the kidney disease progresses, the other treatment options include dialysis, whether it's peritoneal or hemodialysis, and or kidney transplant. Treating kidney disease can be very expensive. The average cost per person per year was about $27,000 to $77,000 depending on the stage of the disease. The more advanced the stage, the more expensive the treatment.
In 2002, Chronic Kidney Disease Clinical Practice Guideline established the landmark 5 stages of kidney disease: highlighting for the first time the opportunity for slowing the disease and preventing complications through early detection. This effort is changing the way kidney disease is identified and treated, providing millions of patients with the opportunity to stay healthy longer.
Treatment of chronic kidney disease can cause many complications. Medications to control your blood sugar can cause low blood sugar. Blood pressure medications can cause low blood pressure. Dialysis can lead to infection, causing sepsis, anemia, requiring blood transfusion, and elevated potassium leading to heart arrhythmia. Kidney disease staging is based on glomerular filtration rate, or GFR, which is a measure of how much blood passes through the glomeruli each minute. Stage 1, GFR is 90 or higher. Stage 2, GFR is 60 to 89. Stage 3, GFR 30 to 59. Stage 4, GFR 15 to 29. And Stage 5, GFR is less than 15. As the stages progress to a higher number, the GFR decreases, meaning there is less blood filtering through and less waste being filtered out.
Risk and environmental factors. People who have or have a family history of the following should be screened as they are at risk of chronic kidney disease: diabetes, hypertension, past kidney damage, obesity, cardiovascular disease, or if an individual is 60 years of age or older.
The populations most affected by chronic kidney disease include African Americans, Hispanics, and American Indians, in part due to these populations having a high incidence of diabetes and hypertension, which can lead to CKD.
To lower your risk of getting chronic kidney disease, focus on two conditions: diabetes and high blood pressure. These are the two biggest threats to your kidneys. Many people have these conditions. If it's been a while since your last checkup, you may want to schedule one. If you are diagnosed with diabetes or hypertension, work to bring it under control. The things you do to take care of your heart and weight, like eating a healthy diet, not smoking, limiting alcohol, staying active, and taking any medicines your doctor prescribes, also are good for the kidneys. Dietary restrictions vary depending upon the stage of kidney disease. People who are in early stages of chronic kidney disease will have different dietary restrictions because your body is unable to remove excess sodium, potassium, and phosphorus. As a result, they are at higher risk of elevated blood levels of these minerals. Individuals in stages 1 to 4 with chronic kidney disease may need to limit the amount of protein in their diet.